Hi guys, I'm back and welcome back to Patho and Chill. So last video we talked about nephrotic syndrome, and I promise you guys that we're gonna talk about nephritic syndrome now. So nephritic syndrome, it has an I in there. I is for inflammation. That is what causes this syndrome. Remember, nephrotic syndrome was non-inflammatory. Nephritic syndrome is inflammatory. Roll the intro. Okay guys, so let's dive right into it. So like I said, nephritic syndrome has to do with inflammation. The endothelial blood vessel lining is starting to deplete, and so that's going to lead to its injury, and basically it's going to become very leaky. And so red blood cells are going to basically diffuse from the blood vessels into the tubules, and that's going to lead to our first sign, which is hematuria. So increased red blood cells in the urine. Okay, so because of this injury to the blood vessel, it's basically going to decrease the glomerular filtration rate. And so as you decrease that rate, you're basically going to have oliguria, which is basically a decreased urine output. And along with that, we're going to get azotemia, which is an increased blood urine nitrogen and creatinine. And as always guys, a decreased GFR is always going to stimulate the body to basically secrete renin and aldosterone. And as you guys already know, because we've talked about it many times before, renin and aldosterone are going to increase the sodium reabsorption and thus water reabsorption. That is going to potentially lead to edema and hypertension because of that increased blood volume due to the increased reabsorption of sodium and water. So those are two other signs commonly seen in nephritic syndrome. So now let's quickly jump on to a disease that is related to nephritic syndrome, which is known as Post Streptococcal Glomerulonephritis. And so what exactly is this, or what causes it? And it's commonly seen in children from the ages of 6 through 10 whenever they are infected by a group A Streptococcus beta hemolytic streptococcus bacteria, and normally occurs 1 to 4 weeks after the infection has cleared. And so basically the first sign that one will commonly see whenever they're experiencing this post-streptococcal glomerulonephritic disease is colored urine. And now remember how I told you guys that nephritic syndrome is caused by an inflammation? Well, this is the perfect example, and thus why this disease is associated with nephritic syndrome. Well, we basically have the antigen of the strep A bacteria that is circulating near the renal blood vessels. And so this antigen will either meet its antibody in the circulation leading to the kidneys, or the antigen will actually be filtered into the tubular secretion, and the antibody will follow along it and basically bind to it and form its complex already in the secretion. And so basically, like I mentioned, it's going to cause an inflammatory reaction in which once that complex occurs, it's going to start recruiting a neutrophilic influx along with complement. And all of this will basically generate this inflammatory reaction that will start to harm the lining of the kidneys. And this will be seen as hypercellular glomeruli, in which the endothelial and the mesangial cells that make up the glomeruli and the blood vessel linings of the kidneys will basically start to increase in number of cells, thus the hypercellular glomeruli. And if you do like electron microscopy, you can actually see subepithelial deposits, and these deposits are actually the complexes of the antigen and the antibody that are then seen in the kidneys. Moreover, if you do immunofluorescence, you can actually see the staining from the fluorescence that binds to those IgG, all the antibodies and the complement, which basically show and diagnose that there's an inflammatory reaction occurring and thus a disease. And so to finish off this video, the prognosis for this post-streptococcal glomerulonephritic disease is actually very good, in which about greater than 95% of patients that get this disease actually recover properly, and within around 2 months of the disease, these complexes are degraded and the glomeruli function goes back to normal. And as always guys, if you enjoyed this video, please make sure you hit the like button down below. Check out my other videos, hit the subscribe button as well. I will see you next video. I hope you're having a very chill day, and peace out.